Welcome to another edition of Eat This, Lose That. And today afternoon, we are going to have another discussion with our esteemed guest, Dr. Ananthakrishnan, who is a retired orthopedic surgeon. And last time he talked about foot and how to take care of the foot, the importance of good posture, the importance of standing on your heel, the importance of wearing the right kind of shoes, especially shoes without heels. If you have not watched this, I strongly suggest that you go back and watch the previous episode where Dr. Ananthakrishnan talked about wearing the right kind of shoes and protecting your foot and different types of foot problems one can encounter as we grow in life. So today he is going to talk about ankle and what is an ankle joint, where is the ankle joint. Most people don't even know where the ankle joint is, and what problems can one experience with ankle joints. Can ankle joints be involved with gout, and what are the traumatic problems an ankle faces, and what side effects one can expect?
The ankle really is a composite joint. It's not a simple joint. Okay, it's a modified hinge. But the thing, when people talk about the ankle, especially to the layman, you talk about all the joints. That is basically between the tibia, which is the big leg bone, the fibula, which is the smaller bone on the side, and the talus. That is the true ankle joint. But to the layman, he also includes the joint below the talus, which is also called, technically it's called the subtalar joint. And really the subtalar joint plays a very important role in the ankle, using the layman's terms. The subtalar joint is what allows you to walk on uneven ground. It allows the tilting of the foot, both inside and outside. Most of it occurs at the subtalar joint. It does not occur at the ankle joint. And that's the common misnomer. Okay, the ankle joint really is, the best way to describe it is like a hex spanner or a hex wrench in a hex nut. Okay, the talus is the hex nut. The hex spanner is the tibia coming down along with the fibula. There is a joint between the tibia and the fibula at the level of the ankle, which is called the syndesmosis. It is a very tough, gristle-like joint. There is some movement there, not a lot of movement. On the inside of the joint, there is a ligament which is like a spring, sometimes referred to as a spring ligament. It really is called a deltoid ligament. And on the outside of the ankle, you have three separate ligaments which are attached to the fibula. And when you talk about ankle sprains are one of the things that happens most commonly. Okay, just a simple twist around you get tripped on a rug, stepping off a curb, all these things can give you ankle sprains. An ankle sprain, if not treated properly, can give you a lot of problems down the road. Okay, ankle sprains we categorize into three grades. The simple grade is where the ligament is stretched out, or that's grade 1, but it's not really torn. Grade 2, some parts of the ligament apart from being stretched out are torn, and grade 3 is when the ligament is completely torn. And if you remember what we talked about when we talked about the foot, ligamentous injuries take a longer time to heal
Than the bones.
than the bone. If I was going to rather have an ankle injury, I'd rather have an ankle fracture rather than an ankle sprain. Repeated sprains of the ankle are very common because 1, they are ignored, 2, they are not properly treated. The average general practitioner tends to ignore the ankle sprain, saying, oh, it's only a sprain, don't worry about it.
Say that again, okay. Average general practitioner, whenever you have an ankle pain, when you go to him, always remember one thing. If you have an ankle fracture, that is better than ankle sprain. Two, if you have an ankle sprain, usually you don't get the right treatment, so you need to insist on making sure you get the right treatment, because if you don't take care of the ankle sprain, you're out for more problems down the road.
Yeah, it loosens the ankle basically. If you don't treat the ankle sprain properly, it heals in a stretched position. That makes the ankle, remember I said it's like a hex nut in a wrench? So now the hex wrench is a little bit loose. So the nut can go just about anywhere. So if you have one ankle sprain and you don't treat it properly, repeated strains become very common. And what happens is the first time it happens, it's very painful. Second and third time, it's not really that painful. You just feel it, you feel a twinge, you ignore it, keep going. A few days later, you get another one. So just repeated trauma to the ankle occurs. Okay, most of this is on the outside or the lateral side. Okay, this is where those 3 ligaments I told you about on the outside of the ankle, they are the ones which tear and cause this chronic problem. The inside ligament is much more serious because there is really not much bony support for the ankle on the inside. It's all ligament. And it's a spring ligament, and it also, the reason it's called a spring ligament, remember the talus, which is the bone in the middle of the ankle between the tibia and the calcaneus or the heel bone, is kind of resting on this ligament on the inside. So because if you get an injury to that ligament, that support gets weakened. So that can cause further problems. And the other thing, of course, is these take a long time to heal. So the first ankle sprain should ideally be protected. It does not need a cast. You can use these air splints or gel splints or different splints that you can get, which come on either side of the ankle.
And just tight, keeps it tight.
Yeah, keeps the mechanism tight. And that thing will hold the ankle in place till the ligament heals. The advantage of these gel splints and the air splints and all these other different types of splints is you can still take a shower. You can take the splint off. You can take a shower. In the old days, before the splints were there, we used to put them in casts. And casts, especially if this happens in summer, and that's usually when you get most of these injuries, in children especially, the cast starts to stink because you sweat, your skin dies, and as we all know that the
dry skin,
superficial layer of the skin dies and usually gets shed when you take your shower or bath. Now, if you're in a cast, you're not able to do that. And as each succeeding layer of skin gets shed, it starts to decompose, basically. And that's what gives you that stink, the sweat plus this dead skin. Fortunately, as I said, now because of these splints, you can take them off and get into the shower or get into the tub and take a bath and clean all this dead skin off. But the important thing is when you have a splint for a strain, when you take it off to get into the shower or the tub, be very careful and don't put the ankle in any awkward positions. You got to be careful about it.
But you can stand flat, straight on it.
You can stand flat, straight on it, or the best thing would be to sit in a chair and take a shower. Then that way you won't be putting any stress on the ankle. This will need to be protected for a minimum of 8 weeks. Okay,
That's longer than a fracture.
It's the bare minimum. Most of these will not heal for close to 12 weeks.
Wow.
So, whereas a fracture will start, it would be safe to start walking on a fracture by 8 weeks. But in an ankle sprain, it takes a lot longer. Repeated strains of the ankle, as I said, makes this joint unstable. When it makes the joint unstable, the cartilage on top of the talus or of the hex nut that cartilage getting damaged, and that'll slowly chip away, and it drops into the joint and acts like a foreign body and produces arthritis. And when you get that, then you have the problems of a painful ankle.
So when people say ankle joint is the only joint where you do not develop a degenerative joint disease, it's wrong.
It's not true.
It's not true.
The ankle takes a longer time to get symptomatic. That's the only difference. But when it does get symptomatic, it's difficult to treat. It's not very easy to treat an ankle arthritis because the options are very limited. Okay, in the ankle replacements.
Yeah, I was going to ask ankle replacements.
Ankle replacements are there nowadays, but one, we do not really have any very long-term results. And when we talk of replacements, you need to talk about 15 to 20-year follow-ups. And we don't have enough of those in the ankle. Two, when it's the ankle which is giving trouble, most people will say, it's only the ankle. You're exaggerating, you don't need anything, you just protect it, put a splint on, and you can keep functioning. That really is not true. The other treatment for it is an ankle fusion or an arthrodesis.
But then it becomes harder to walk.
Which makes the ankle, its position of fusion is usually about 10 degrees of plantar flexion or towards the ground, the ankle being towards the ground. The problem with that is it's fine, you can walk on level ground, but the minute the ground is a little unstable, or a little uneven, it becomes more and more difficult to walk because you basically have to lift your whole foot and put it down. You don't have the normal mechanism to walk.
It also puts enormous stress on the other joints.
That'll, of course, the stress, if it's not taken by one joint, is transferred to the other joints, which comes up to the knee. It goes out, it always goes up. Okay, the other thing in the ankle, remember I talked about that gristle-like stuff in between the tibia and the fibula, the syndesmosis. Syndesmosis injuries are the most commonly missed. Okay, the injury to the syndesmosis is when you have this ankle sprain, when it is more towards the grade 2, 2.5 to 3, the force continues on. It doesn't stop. It doesn't completely dissipate. So what it does is puts a strain on the syndesmosis. So it's just like if you're, again, going back to the thing like a hex wrench and a nut. See, if the hex nut is holding, the wrench is holding the nut in there. As it twists, the ligaments tear. And if you still have force left, depending on the degree of trauma, then the nut will keep pushing against the syndesmosis as it rotates. And that will tear up the syndesmosis, and that's the joint below there. And what that does is, the bone being the ankle, since it's surrounded by ligament, the tendons and stuff, it springs back to a more or less a normal position. So unless you take a very specific X-ray and you know what you're looking for, so you will not see the syndesmotic injury.
Routine X-ray sees
routine AP and the routine lateral films will not show that, because that joint is about 15-30 degrees posteriorly or behind. So you have to turn. You have to take a proper ankle, or a mortise view as it's called, which means it shows the whole hex wrench. Then you can see it. Then you'll see the thing separated. Otherwise you won't.
So do they do it routinely, or no, you have to specifically ask for it?
You have to ask for it. It's not usually asked. That's why I said general practitioners tend to miss it, because they usually get an AP and a lateral. That is normal, so they say, fine, you're okay, you just have a sprain, don't worry about it. And if you have an injury to the syndesmosis, that's completely missed. And what happens if the syndesmotic injury is missed? Every step you take, this joint opens, closes, opens,
Ooh.
closes. So it's
That's
not
painful.
Not initially, it's painful, but not later on.
Because it,
The joint adapts to it, but it becomes arthritic very quickly because it's no longer a normal joint. So it's
No.
giving in and out, in and out, in and out. So that causes more problems. So that's why I said, general practitioners tend to miss this because they only get 2 views. They do not get the 3rd view.
So if I ask for ankle series, will that help?
Series should help because most radiologists or most X-ray lab places know that when you ask for a series, you're asking for 3 views. But to be safe, you usually write down AP, lateral, and mortise view.
Mortise view.
So that they have to do one. For that, they have to rotate the foot from the outside to the inside so the mortise is now fully seen.
Thank you for joining us on this Eat This, Lose That video newsletter. I hope you enjoyed it. I certainly did doing this. Now, if you have any questions after watching this, please forward us your questions at info@reddycardiology.com. Based on the questions you ask, we will create more video newsletters and post it for you to watch. Please follow us on Instagram, Twitter, YouTube, and like us on Facebook. And if you like what we are discussing, please forward this to as many people as you know. Our goal is to target 1 million people. Thank you.